Hi everyone, I'm Mike Green, Public Information Officer in the Allen County Commissioner's Office, and welcome to Countyline. Hi everyone, I'm Mike Green, Public Information Officer in the Allen County Commissioner's Office, and welcome to Countyline, the program featuring news and information about your county government. You know, everyone in our community should have the opportunity to have a good life, and that includes good health. Being able to afford emergency and maintenance medicine is critical to achieve and maintain good health, and yet many in our community are struggling to get their medicine. In fact, as many as 4 in 10 people nationwide don't get their prescriptions filled. Well, that's where the FamilyWize prescription drug discount card program comes into play. This is a free program to everyone in our community, whether you have insurance or not, and it can save you as much as 35% on the cost of your prescription drugs. Now, since 2008, FamilyWize has partnered with the United Way of Allen County and the Allen County Board of Commissioners to provide these cards. And recently, the local program celebrated a major achievement.
I'm Commissioner Therese Brown, and I want to thank you for coming this morning. The Board of Commissioners, along with the United Way of Allen County, are taking the opportunity today to update the public on the progress of the FamilyWize prescription drug program in Allen County as we begin the new year, and to announce a very significant achievement for our local effort. Here with me are my fellow commissioners Nelson Peters and Linda Bloom, along with Todd Stevenson, President and CEO of the United Way of Allen County, who will have some remarks later afterwards. Also joining us today are John Silcox from the Allen County Fort Wayne Board of Health and Eric Claybaugh, a representative from Parkview Health, both who have been a dramatic help in the process of making this a successful program. First, a little background. The FamilyWize program came to our community in March of 2007 through the Allen County United Way. And for the first year, the United Way offered discount cards to member agencies through their organization and to have them distribute to their clients. And during that time frame, the Board of Commissioners began examining the various options and opportunities of a prescription drug program, and that being offered nationwide. And Bill Brown, who was county commissioner at that time, was instrumental in that process, who is now, as you all are well aware, is a county councilman starting the first of this year. The goal at that point in time was to be able to associate with a program that would allow our citizens to afford prescription medications. And after looking at several programs, it was decided to choose the FamilyWize program because of its track record in other communities and the partnership already made with the United Way and FamilyWize. So in April 2008, our office began working with the Allen County United Way to help spread the word about the program. We also enlisted the aid of a number of local partnerships, municipal and county agencies and departments to help distribute the cards to a number of other agencies. And now today's news. Since the beginning of the program in Allen County back in March of 2007 and through the end of November 2012, FamilyWize cards have been used in more than 61,000 times at participating pharmacies. The average savings is $16.62, which figures out to be approximately 31% savings for those using those cards. But the best news, which we are proud to announce today, is that the FamilyWize program in Allen County has saved our residents over $1 million. Clearly, this program is having an impact and helping Allen County residents who are struggling during these times of tough economic situations and to get the prescription medications that they need. When 1 out of every 4 individuals is having trouble buying their medicine, we look forward to every possible way to make sure every person gets the provided help they need through these prescription drug cards. We are very grateful to those organizations and governmental departments which have been a part of this great achievement and continue to encourage both private and public sectors to help us promote and expand the FamilyWize program within Allen County. And we are pleased to announce today that another community organization is becoming involved in the FamilyWize program. Later this month, the YMCA of Greater Fort Wayne will begin helping us to distribute these cards in its 4 facilities and its child care service branches. Now it's my pleasure to introduce Todd Stevenson, the President and CEO of the United Way of Allen County. Mr. Stevenson?
Well, thank you, Commissioner Brown, and also thanks to Commissioners Peters and Bloom for your support and ongoing leadership for this important FamilyWize initiative that's benefited so many here in Allen County. I'd like to also acknowledge a couple, 3 people from the United Way organization that have been deeply involved in one way or another with this initiative. First of all, Tiffany Bailey, who is our Director of 211 Referral Services, and she also is directing our income, health, and basic needs areas at United Way. Also would like to introduce Dr. Jeannie Zaire, who is our Director of Community Impact, and Chris Rouse, who's our Director of Resource Development. As I mentioned, we focus on several areas at United Way: education, income, health, and basic needs. We provide a lot of funding in support of those services to our partner agencies in those areas, and all designed to work to help ensure that, among other things, people have the access to the resources and support for their well-being. We do this at United Way by supporting services at these agency partners, such as medical treatments, immunizations, AIDS and cancer support, prenatal health, respite and hospice care, and, importantly, specialized transportation needs to and from healthcare appointments. In addition to these services, the FamilyWize program provides an incredible savings, as you just heard, to the people in our community, as well as an important resource for individuals and families to lead healthier lives in Allen County. The FamilyWize cards are very easy to obtain and use for their prescription needs. They make the savings quite accessible for our local residents. We hope today that the news of these savings will further encourage others to use the FamilyWize program. The milestone of reaching more than $1 million in savings for residents here is truly remarkable, and we look forward to continuing to be an important part of this program in our community. Again, I want to thank the Allen County Commissioners for their leadership, and at this point I'll turn things over to Commissioner Peters for some additional comments.
Thanks, Todd. I appreciate that, and thank you all for being here today. Again, I want to, although we've already acknowledged him in his absence, I want to acknowledge Councilman Bill Brown, who actually brought this partnership to the forefront of the Allen County Commissioners some years back. And partnerships are really what this community is all about. So our thanks to United Way in working with us to ensure that we can help get this message out to the people that we serve. There, as you all know, is so much uncertainty in healthcare these days. We've looked at double-digit increases in healthcare costs over a good part of the last 5 years, and we're probably going to be looking at greater increases in healthcare as time goes on, but we don't know. One of the things that the FamilyWize program does help drive is a little bit more certainty into what the future may look like. What this program really does is helps cover costs above and beyond what some of the insurance programs may cover in all of the businesses that are out there. So we're trying to reach out to those who can't afford health care as it is right now, but we're also trying to reach out to those businesses that may be providing programs where the health care doesn't rise to the level that the FamilyWize cost savings provide. Now, we're here today to celebrate $1 million worth of savings that FamilyWize has brought to us. But I don't know whether you know, there are also, in addition to that, 2,812,000 $21,000 worth of savings for diabetes and heart disease that the prescriptions that have been provided in those particular areas have provided for. So all told, we are closing in on $4 million worth of health savings in this community that we probably wouldn't have otherwise seen without the FamilyWize program. Finally, let me just say part of what we're here to do today is to encourage business to partner with Allen County, to partner with the United Way on this FamilyWize initiative. We've embraced it over the last few years. You're here today hearing about the savings, and we're here to tell businesses in the community as well as others that there are savings to your businesses, there are savings to your employees, and there are savings to the people that we all want to serve in joining up with the FamilyWize health program. Just to add a few additional remarks, I'd like to invite Commissioner Bloom to the podium.
Although this is a wonderful, worthwhile project, we couldn't have done it without all our pharmacies. We have 61 pharmacies included in the group that helps the FamilyWize card. Without them, we couldn't do it. So a big thanks to those people who have decided that this is the way to go. Healthcare is increasing in cost, and this is a wonderful program we have. Thank you.
Thank you, Commissioners Peters and Bloom and Mr. Stevenson. As you can see, this is an opportunity. It's not only proven that it's something that's beneficial to the citizens and constituents that we serve in Allen County, but it's also something going forward in these uncertain times to allow individuals the opportunity to save money, to make their dollar stretch that much farther, to be able to provide for their families. So again, thank you for everyone being here today. Thank you all for bringing this forward before my time, but allowing also us to continue this opportunity and expanding it not only with the YMCA, but with any other organization that chooses to do so. This is a collaborative group effort, and we would like to continue to see it grow. So if you know of anyone that would be interested, just feel free to have them give us a call. Mike Green, our Public Information Officer, would be more than happy to help direct, as I'm sure Mr. Stevenson through the United Way would be happy to assist in getting these cards out to your facilities.
And we're here now with Todd Stevenson, who's President and CEO of United Way of Allen County. And Todd, tell us a little bit, I guess kind of put a personal face on the FamilyWize program and what it means to the community.
Well, it means a great deal, obviously. The savings of over $1 million accumulated, plus the other benefits that accrues to the individuals and families who utilize this. We're obviously in position at United Way on a daily basis to see people and families that are having struggles financially and with other issues. Health typically creates a lot of financial issues and stress in many situations. So we see through our 211 call referral center individuals who reach out looking for solutions, and many of those solutions are provided through partner agencies of ours, other providers in the organizations, and it's just great to have this FamilyWize program because it does provide an additional layer of savings and help vis-a-vis the discounts that they may not today be beneficiary of under if they are insured through their insurance plan, or typically if they're uninsured and have to pay quote full retail at a prescription for a prescription.
And this isn't just a problem among the low-income sector. This is a problem that, as far as healthcare costs, kind of moving up the ladder.
Absolutely. I think we all hear horror stories from time to time about people who are gainfully employed, making a living wage in many cases, but are facing monthly prescription bills in the hundreds of dollars per month. And a program like this really helps those situations immensely.
And it's for folks who may even have insurance.
Absolutely. This is a discount program. So if your insurance provider and your insurance plan provides for a prescription cost that's lower than the FamilyWize discount, that's great. In many cases, we've heard that the FamilyWize discount is actually a better option for families, and pharmacists will honor the best price for the customer if using the FamilyWize card.
Okay. Todd, thanks a lot for your time. We appreciate it, and thanks to United Way for helping bring this program to our community.
Well, thank you, Mike, and we thank the Allen County Commissioners for their leadership and stewardship of this program over the years. Thank you.
Every 3 months, the Community Research Institute at IPFW puts out a report to the Allen County Board of Commissioners dealing with economic events, data, and trends, both in the community, in the state of Indiana, and nationwide. It's called Allen County Insight, and the most recent edition of Insight is out now. John Stafford is the director of the CRI at IPFW, and he joins us now to talk a little bit about what's contained in this quarter's report. And John, first of all, thanks for taking time to join us.
Appreciate doing this.
You focused this edition of the Insight Report on the labor force. Tell us about some of the things that you wanted to make the commissioners and the county in general aware of.
We're tracking the number of people in the labor force, and that would be those who are either working or are actively seeking employment, and that the two of those add up to our workforce. Tracking that is a strong economic indicator. When people perceive that there are job opportunities in the community, they'll get back into the workforce. When they perceive that they're not, they'll fall out of the workforce. Sometimes just being discouraged, sometimes to go back for more education, training. Sometimes they'll take an early retirement, a variety of reasons. One of the things that we have noticed is that our labor force participation rate, adults 16 and over that are in the labor force, is higher in Allen County than we find across the state or the nation.
Why do you find that, or what seem to be the reasons for that?
Historically, we've tended to have somewhat lower wages than nationally. It may require more than one wage earner in a household in more instances than you might find across the country. Some of it may be a little bit about the composition of our employment and of our population.
Philosophy and lifestyle also, in terms of this is an area that is considered to be strong work ethic. Yeah.
Yes, I would agree. Strong work ethic. People really believe that whenever possible, they ought to bring in salary and wages.
Now, what about in terms of occupations? What are we seeing in terms of our job market out there?
As we began to come out of the recession, one of the first areas to recover was manufacturing. And it really led a strong recovery for Allen County, for Northeast Indiana. The last couple of years, we've seen that somewhat level off, and other segments of the economy gain in jobs. Healthcare clearly has been a strong suit all along, but we've seen other increases in retail trade and in leisure and hospitality sectors. We've also seen a growth of jobs in professional and business services, although a key component of that is temporary employment. So where we're seeing some reluctance of employers to hire full-time, they're hiring part-time employment as they maneuver through a variety of post-recession issues.
This area has been traditionally high in terms of manufacturing, as you mentioned, an important component. Are we seeing that rebound any at this point?
We're beginning to see some news nationally that manufacturing is again on the move, increasing in terms of production. That should lead to increase in terms of employment. We're fairly tied to the national manufacturing economy, so we should see some of that start to come through in Allen County in the year or 2 years ahead. But there are a lot of variables there, a lot going on, a lot of people waiting to see what Congress does, a lot of people waiting to see what changes the healthcare legislation will make for them as an employer. just a lot of hesitancy.
One key component in this quarterly edition of Insight dealt with workforce educational attainment, and you've got some statistics which bear out the importance of high school diploma, bachelor degree from college, et cetera, in terms of gaining employment. And I'm sure there are some people who would say, well, yes, you would figure the more education you have, the better chance you have of getting a job. But there were some disturbing numbers that you found as you were doing this study?
Like you, well, yes, that makes sense. The more education, the more likely I am to gain and hold a job. But the numbers, as you climb up that educational ladder, are really startling, and they surprised me. For example, if you don't have a high school diploma, unemployment rate in here is just under 19% for that group of the population. If you got a bachelor's degree or higher, it's 2.5%. And the disparities are huge. Some would say lack of a high school diploma today is an economic death sentence. And I think intuitively many of us understand that, but we have work to do to reach out to those young people who, for whatever reason, today don't understand what that not completing high school, and going on beyond high school, a certification, an associate's degree, how critical that's going to be to their economic future.
And not only in terms of getting a job, but in getting a good job, a good paying job that helps the community as a whole.
Can sustain an individual, can sustain a household.
Well, then in your opinion, from a standpoint of government, what things need to be done to help get this message out or to help promote the idea of attaining a higher degree in terms of education?
I think elected officials all being aware of this, talking about it, they are role models to many in the community. They have a podium that many others don't have. So emphasizing that, working with a local education system, being in the classroom, all of those things are important factors.
Well, let's try to end this at least on a little more positive note. Sure. You also talked in this report about a recent study called the Milken Best Performing Cities Report, and there is some good news there. Absolutely. For our area.
Every year, the Milken Institute out of California ranks the 200 largest metropolitan areas in the United States on a variety of factors, 9 components, and we jumped from 2011, we were 127th out of 200, and this year we're 59th. And in terms of last year's worth of job growth, we ranked 13th.
What seems to be the factors that have helped see us that improvement?
Strong job growth. While as we look at it locally, we're still sitting here with an unemployment rate between 7 and 8% from month to month. That's too high, and we all know that. But as we compare ourselves with many other metropolitan areas, relatively speaking, we've done well. The strength of the manufacturing rebound was key to that. Concentration in healthcare has certainly assisted.
So, while there's still work to be done, the arrow seems to be pointing up right now for us.
It does. And it's not just been a one-year jump. We've come over a 10-year period of time where there were a couple of years, 2003, 2004, we ranked 191st out of 200 on the Milken Institute index, and now we're at 59th. So it's been a steady climb over a decade. That's what you like to see.
Right, not a blip on the radar screen. It's something that...
1 year, but a 10-year steady progression is significant.
Well, we hope it will continue. And John, we look forward to 3 months from now getting another report from you about the economy here in our community. Thanks a lot for joining us and talking about this. And let folks know that if you'd like to see a copy of Allen County Insight, you can go to our website, www.allencounty.us, and you will find a link there that will allow you to read and download the full report. John, again, thanks.
Thank you, Mike.
Serving on a jury is one of the most important civic functions that a citizen can provide. But let's face it, it's not always the easiest process to deal with. Well, here in Allen County, a move is underway to try and make this, I guess you'd say, maybe a more user-friendly approach to serving on a jury. And with us to talk a little bit about the system that is in place is Allen Superior Court Judge Francis Scull, and also the head of court operations here for Allen County, Jeff Leffers. And first, both of you, thanks for joining us. We appreciate it.
Thank you.
Judge, let's talk about, this is a fairly new software technology that Allen County is using. You had a recent upgrade, and we're going to talk to Jeff a little more about what the new system can do, but kind of give us a little background on how all of this came about.
It all started back in the late 1990s. I was on a committee that was looking at different ways that the court systems deals with its jurors, and we were in the process of trying to adopt some new jury rules, which ultimately did get adopted back in 2002. And having that information kind of as a bit of a backstory, I knew what was coming. And I knew that we in Allen County needed to upgrade the way we were dealing with our jurors, and the fact that we had no electronic system to manage our folks, we had no electronic system to try to figure out how to get people into the system and effectively utilize them. I knew that this was coming, and I knew that Allen County needed to be on the cutting edge of that. So we started looking at software systems to manage our jury pools, and went to Brownsville, Texas, and ultimately settled on Tyler Technologies, Tyler, Texas with Judicial Systems, Inc., to give us, at a great price, a really neat software system that we could use to manage our juries. So it kind of started back then.
As we said at the outset, an important function for citizens, but on the other hand, because of the fluid nature of the judicial system as to whether there's going to be a trial or not a trial, and sometimes it can be almost a last-minute type situation, that's where the need for this came in, I assume.
Oh, absolutely, and that's a very good way to describe the court system, and jury trials in particular as being very fluid. I was in this courtroom for the last couple of days doing a jury trial that started back in November. So I mean, it just kind of, it's hard to let people know, and it's all about access. It's about jurors' access to the system and jurors' access to us in the system on, do I have to report, do I not have to report? And as you started out, you know, jurors are the only ones in the system that aren't there voluntarily. So the fact that we're not they're not there voluntarily, we try to make their experience as pleasant as we possibly can.
Okay, Jeff, so tell us a little bit about this system, which is called mJuror. As we mentioned, as Judge Gull mentioned, this has been in place for a little while here in Allen County, but just recently you've upgraded the software. Tell us a little bit about what it has done in the past and what it is now capable of doing.
Well, earlier this year, what we started to enhance our jury system. We needed to upgrade it again, and Judge Gull pushes technological enhancements. We've had interactive voice response system just installed, along with the internet website, web-based system installed, so jurors can access their questionnaires either on their cell phone, on their telephone at home, or on their PC at home, or even a smartphone. And they can fill out the questionnaires, and to complement that, we wanted them to also, instead of getting a summons form to report for jury duty, also be able to text and enhance their access to the jury system. And this new mJuror gives them complete two-way conversation access to the jury system.
So in the past, the system that we had in place was simply pushing information out to them. Now there's the chance to interact.
Yes, they can't always 24/7 get someone from the court system. So this way they can get a two-way conversation 24/7 just by accessing this new texting feature.
Okay. And what kind of costs are we incurring because of this?
The beauty part of this is that, as my father-in-law used to say, is it's costing nothing, because we worked with this software vendor. We've been working with them over a decade, and they said if we would help them develop it and do some testing, they would give it to us at no cost.
What kind of response have you gotten back from the public? Have you heard from anyone as to whether the system has worked well for them and what their experience has been?
Well, we're going to try to get more information on that, but right now, the best information we get is a response from jurors who use the system. Now, they can also, besides texting, they can email, which makes us even doubly good. But the first first 2 weeks, we had approximately 41 individuals using this texting, emailing service with about 141 different texts. So without any information to the jurors that this is available other than through their summons, they started using this pretty robustly.
And this has a very high level of security attached to it, I assume.
Oh yes, the only way they can access it, they have to go to a website. They're instructed to go to a website, jury duty at allensuperiorcourt.us. After they go to that website, they're prompted to put in their jury ID number. And after the jury ID number, it prompts you to put in a unique electronic signature. And that's the only way they can access it. And as soon as they put in that signature, it says, "Hello, I'm mJuror. You're scheduled to report for such and such a date, and here are some key words you can start off with."
Judge Galt, talk to us a little bit about the work that's been done to implement this system in Allen County. This is a project that has involved a number of different offices and departments within county government.
Oh, absolutely. This isn't something we could have done by ourselves. We have many, many partners. Allen Superior Court does the bulk of the jury work, but Allen Circuit Court also does jury trials, so we needed to get their cooperation, and Judge Tom Feltz was very gracious and agreeing that we could continue to run this system. ATOS, the computer software people that the county uses, very important in getting this up and going and in working with our vendor and working with Jeff and making sure everything was going smoothly. The clerk of the courts had to be involved as well, because the clerk of the courts is responsible for some of our parts of our system. We had other staff members within the court system itself, different divisions from the court system itself that were instrumental in getting things moving. Jeff, who am I missing? I know we had...
Then we started out with, we gave a presentation to some city, county council members. And then also we worked with Judge Sims and Carlene Thompson at Allen County Juvenile Center, because we had to use their particular jury server for this mJuror application.
So a lot of people involved in this to make this happen. From your perspective as a judge, what's the most important thing that you're getting out of this mJuror program?
I think the most important thing that we're getting out of it is a recognition that the people that we are bringing into the building to perform their most important civic function, that we are as accessible to them as we can possibly be, and that we recognize that we have a much broader, more diverse jury pool that we are dealing with. And it's a much younger jury pool than we're dealing with. I mean, when we get folks that are calling our office going, "Can I fill this out on the internet?" That's what stirred us to get the internet and the voice interactive. And you look around, a lot of the young people, they live and breathe on their iPhones and their smartphones. So that's just another way to connect. It's another way to provide a service to the juror that's easier for them to do. And it's all about, it really is, the court system is really all about our jurors and in treating them well, providing for them, and making their service as rewarding as possible.
Well, it sounds like a great service, and we appreciate your time, both of you, being with us today and talking a little about the mJuror system. And so if you're going to be called upon to serve perhaps on a jury in the near future, be expecting to find out more information about mJuror. And that will do it for this month's edition of County Line. A reminder to you that if you'd like to watch this program again or previous editions of County Line, you can do so on your computer in a couple of ways. One is to go to our YouTube channel, which is Allen County Info, and the other resource available is our Video on Demand channel. We share that with the City of Fort Wayne and the Allen County Public Library, and we show not only previous episodes of County Line, but we also have various boards and commissions meetings of county government that you'll be able to watch anytime you wish. To get to either of those sites, the best thing to do is to go to our main website, which is www.allencounty.us, and there you will find the links to both our YouTube channel and the Video on Demand service. I'm Mike Green, Public Information Officer in the Allen County Commissioner's Office, and we will see you again next time on County Line.